Hello, I'm Sabri Adel Sadi at the Center for Research and Education on Violence Against Women and Children at Western University. On behalf of the Knowledge Hub team, welcome to the Knowledge Hub Presents. The Knowledge Hub presents series features information on trauma and violence-informed research and practice developed by members of the trauma-informed community of practice in their work relating to preventing and addressing family violence. We acknowledge that our work is taking place on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenape, and Atawarandan peoples, on lands connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. We make this acknowledgement to respect the long-standing relationships that Indigenous nations have had with this land, as well as the initial caretakers. We acknowledge historical and ongoing injustices that Indigenous peoples, First Nations, Métis, and Inuit endure in Canada. We accept responsibility as a public institution to contribute towards revealing and correcting miseducation, as well as renewing respectful relationships with Indigenous communities through our teaching, research, and community service. Given that the Knowledge Hub is grounded in trauma and violence-informed health promotion, we also acknowledge the intergenerational trauma and resiliency that has resulted from the colonial agenda and the genocidal project of residential schools, day schools, Indian hospitals, and both in the 60s and Millennium Scoop. We commit to centering these experiences as we continue our work. Today we have Ginette Landry with us. She is the program coordinator at the Beauséjour Family Crisis Research Center, Courage Center in Shediac, New Brunswick. She holds a bachelor's degree in psychology from St. Thomas University and began her career as a case manager in adult protection with the Department of Social Development. Ginette has been involved in the development and research of a new supervised parenting time center and currently coordinates the multi-year PHAC project, which includes the Kids Club and Moms Empowerment Program. Over to you, Ginette.
Hello, everyone. Thanks a lot for joining us this afternoon. My name is Ginette Landry, and as Sabri said, I'm based out of Shediac, New Brunswick, and we are finishing up this PHAC project. Actually, 6 days left, and I just wanted to thank the Knowledge Hub. Really, it's been such a great experience working with this community of practice. I'm really going to miss it, but it's been really lovely meeting all of those people who had projects going on across the country, and I certainly will miss it. But we are definitely we're one of the projects that was finishing in March of 2025, when I know a lot of the projects were finishing up in March of 2026. So I will miss this community of practice quite a bit. So thank you very much for joining me. I got super ambitious with this PowerPoint, and I will not be reading all of it, just sort of going through the important pieces. I know that this PowerPoint will be shared with anyone who wants it on the portal. So if you have any more information, my contact information is at the end also. And if you have any questions about the program, don't hesitate to connect with me a little bit later. So we'll get started. So our particular project was called the Kids Club and Moms Empowerment, a health promotion program for children exposed to family violence in New Brunswick. I'm zipping through the introduction, so we'll get right to it. So like everyone else, COVID-19, dealt us a certain set of cards. We were in the midst of building the Beauséjour Crisis Family Resource Center. It's been rebranded to the Courage Center, but we saw a large increase in both children residing in our housing, our shelters, and as well as child witnesses of IPV needing counseling services in our catchment area. So hence the reason why we applied for the PHAC multi-year program grant. So we had the program here in Shediac, but we also collaborated with another shelter in Fredericton, New Brunswick, where we hired staff and they ran the program at the same time. And so what is Kids Club? So it's an evidence-based intervention program for children ages 6 to 12 who have been exposed to family violence. Kids Club in particular was designed to help children emotionally regulate and challenge their beliefs in the acceptance of violence. And on the flip side, the Mom Empowerment Program helped to build the mothers' empowerment, improve parenting skills, and in particular, to support their children, but in particular to sort of have the support from other women going through the same type of experience. And so this particular program was developed by Sandra Graham Berman. She's a professor of psychology at the University of Michigan. And so she has done lots of research, and hence this is the evidence-based intervention program that she designed. So a couple of the goals were to reduce children's internalizing and externalizing behaviors, um, reducing the harmful attitudes and belief on the acceptability of violence, and ensuring that the children's ability to cope with violence by learning specific skills. So, safety planning, conflict resolution, regulating their emotions, things like that. And the MOMS program, reducing the level of mom's traumatic stress and violence exposure, uh, enhancing mother's safety and ability to parent under stress, and providing support and resources in a group setting. And I think that group setting was most important for the moms. For us, the pilot included the Kids Club and Moms Empowerment. We also provided childcare on site. And just because we have the infrastructure, we were able to do that. Transportation assistance in the form of gas gift cards. So if the women had, some financial issues and they needed some assistance, we provided that for them, including an honorarium at the end for data collection completion. So we found that it was very difficult for some people to participate, and we just wanted to provide as much assistance as we could for them to be able to participate in the program. Program delivery, original grant application was forecasted for 6 groups, so 3 in Shediac and 3 in Fredericton. But in the end, our last group, there was a shelter in Moncton that asked if we would come in, if we had the capacity to take our facilitators out of Shediac and go into Moncton and deliver the program. So that last bit, we delivered one in Shediac and then the following night, one in Moncton. So, and we were pleased about that because it meant that the word was getting out there that we had a good children's program and other agencies wanted to participate. I'm not going to go into this geographical reach, but so like some other programs that have homework component, KCME did not. And we wanted to follow the program as it was for this pilot. We thought we're going to go through it exactly how it's been written. And then if there are other things that we might want to do in the future with it, then we could tweak it, make some changes, add some things. But for the pilot, we did indeed want to follow it exactly as it was written. So the primary audience was rural Francophone in the Shediac-Kapakadi region. So that's sort of on the very east coast of New Brunswick. Urban Anglophone in the Fredericton and Moncton areas. And we also had an idea that we could maybe include newcomer population from either the rural or urban region. But originally, we wanted to have a group solely on a newcomer immigrant, then quickly realized that culturally, we could have people from 5 different areas and culture, they would be very different. And so we sort of put that on the back burner and just opened that up. Though we did have newcomer and immigrant women and children participate in the program, just within the regular group. So the groups were small, 5 to 7 per group. And so we had in total 27 moms, 24 moms, I'm sorry, and 37 children. The average age for moms was 37, average age for the children were 8. We did have some moms who had multiple children. So we'd have one mom and 4 kids, and that was, her 4 kids were practically the whole group. And so one of our suggestions in the end was we're going to figure out, do we want to do something with, that many siblings in one group? Some people are very for it and some people aren't. And so that's something we want to take a good look at when we get there. So the training for the KCME, Kids Club and Moms Empowerment, that's how we shortened it. It was a 1 day training delivered by Dr. Graham Berman. And it was sort of an overview. Another thing that we want to do down the road is more specific training to facilitating um, materials. We purchased the manuals from Sandra, the Kids Club manual, Mom Empowerment manual, and there's a kids workbook. One of the things we did do, there was um, no forms whatsoever in the program. So, we did indeed sort of do the intake, the referral forms, the intake forms. We designed a mom's empowerment workbook to go along with it. A lot of some information where we could catch sort of um, track the progress of the program, which wasn't measured, but we had implemented quite a few documents to sort of supplement that. Um, no pre-implementation materials to measure organizational provider readiness, which there's some programs out there that you have quite a bit of things to go through to make sure that your organization can actually provide this particular program. There's nothing like that for this program. Another thing that we wanted to sort of look at when we were all done. I'm just going to skip that because I can see that I don't see the end of the slides, but I think I can make it up as I go. Here we go. Some of the materials or documents so that we designed once we started the program. So intake referrals, Mom's Empowerment Handbook. We did do a facilitator training manual. It's organization specific, so we just wanted new staff coming in. Our facilitators understood what we did here at the Courage Center as part of their jobs working the KCME. We did feedback forms, progress and activity forms, parent communication forms, and we translated all of those manuals and documents into French. So we offered this particular program in the Fredericton area's Anglophone here in Kodiak. It was either or. If anybody's familiar with New Brunswick or the Kodiak region, you would know how bilingual we are. We sort of go between both languages. So we didn't have any program sort of a solely Francophone group. It was a little bit of a mixture. Resources required for the pilot was the physical location to deliver the children's programming. So again, we were fortunate here to have a very large space downstairs. I want to call that a playroom, but it's quite large. Physical location to deliver the mom's program, so somewhere's private and cozy. And then on top of that, another location for child mining services if you provide that. So again, we have a we have a we're hoping to open a daycare, a trauma-informed daycare downstairs. So we had that space also. So again, very fortunate. We're in a brand new build. This building only went up in 2019. So everything's new and we sort of got ahead of ourselves and made it big enough to provide different programs. Program supplies at the end of the manual, it talked about sort of the craft supplies or any sort of supplies you would need for the kids group, mom's group. The research, mixed method, longitudinal design. The research was done by the Muriel McPherson, Ferguson Center for Family Violence. I never get it right. Basically out of UNB, out of their sociology department. I would like to speak a lot about the research, but you're talking to the wrong person. But I do have a few findings here, but I didn't go into a lot of detail about the research. So basically, it's a 10-week program. I'm going to go through these rather quickly and just read the, the headlines here. So it is 10 weeks for the children's program and mom's program. One of our suggestions, and it came out of the research, was it's 10 weeks long enough. It was just the 1 hour for 10 weeks. And the findings show that we probably would have had better results or there would have been some longevity to it, if that was longer. So session one, introductions and cohesion building. Session two, identifying feelings in general, feelings about violence. Session three, guilt and establishing responsibility for violence. Now these sound like, kind of wordy titles for the kids. You're setting up rules, and the rules are funny, and making up a name for the group, and the rules would be no fighting, like the obvious, no fighting, no leaving the room without permission. And then the kids come up with their own rules that we saw some funny things that the kids come up with their own, no eating sunflowers, and we're all in. We're just jotting these things down and coming up with silly names, and every group sort of went through the process differently. They each had a turn to put something in a hat, and you picked one, or they each said one word and that became the whole title. And so yeah. Um, and so it sounds like that sounds these titles kind of sound like, interesting, but it it really was sort of a play-based, lots of different activities. One of the things we did do too, there were suggested activities, and we went above and beyond and added a whole lot of different activities. Like it's sort of got a lot of sort of puppet play, and some of this programming was written like in the 80s or 90s, and we're like, puppet play for a 12-year-old, we're not really sure about. It's like some of them have had their own iPhone for the last 5 years. So, we've had to come up with some alternate activities. And again, you're always sort of trying to figure out what your little group, is like. And depending on the age, 6 through 12, you could have a bunch of 12-year-olds, you could have a bunch of 6-year-olds. Those activities are going to differ with the age group, of course. Session four, fears, past and present, fears about violence in the family. Session five, safety planning, new ways to resolve conflict. Session six is gender roles, just sort of, what they would like to be when they grow up. Session seven, family relationships, things like drawing pictures of their future families and talking about that sort of thing. Session eight, healthy and unhealthy conflict resolution. Um, there's lots of activities that can be found, YouTube videos, all sorts of things that we used for these particular sessions. Session, excuse me, session 9 is a sort of a review, going through the workbook, interviewing one another to, talk about previous sessions and things like that. And session 10 is sort of a little celebratory. It's presenting them with their certificates and saying goodbye. 10 weeks, for a 7 or 8-year-old, they start to make new friends, it was really great for the kids to see. Um, you have things like, we were measuring things, and that was something, but then you just heard children talk amongst themselves. And one of the sessions, we had a little girl say, "Oh my God, why do you guys keep talking about like fighting in the family?" And then someone replied to them like, "That's why we're here." And it was just so funny, but they made friends, and they knew it was a safe space and that they could talk about things, and they had some facilitators really supporting them through these sessions. So it was these small children developing relationships among themselves. It was really lovely. Mom's empowerment, along the same lines, becoming a group. We did talk about alcohol abuse or substance abuse policy and CPS policies just to start that off. But, we want it to be a safe space. But if there was any issues, we're obliged to report some of those things. And that we sort of had to just really be transparent and throw that out there. Um, Session two, fears and worries, parenting under stress. So, talking about the power and control wheel. It's funny how someone mentioned the power and control wheel, and I was like, oh, everybody's so familiar with it. I'm like, no, people are not familiar with it. Not unless, not unless you work in the field. Your average woman is not going to know about the power and control wheel unless there's issues with power and control. So, we talked about momspirations, and we provided journals, and they could decorate their journals, and tons of activities for them to develop a relationship. And women tend to share things rather quickly. And so that The moms group is usually very cohesive very quickly. Session 3, child development, what's usual, what's not. So we go over some child development charts and things like that. Section 4, communicating about family violence. So, we have some prompts on how they may want to have that conversation with their children. It's difficult. Most moms are like, they didn't hear anything and they didn't see anything. And we go, that's not true because here we are. And so, but it's a hard thing to start. And we gave them some skills and some prompts and things on taking opportunity. If you see an opportunity, you should grab it and have that conversation with your children. Family of origin, we talk about, how they were raised. And, it's not always about like, oh, I grew up in such a rough setting or what have you. We had some women there talk about how wonderful their families were. And so it's a good conversation to have with these women. Session 6, discipline strategies, what works, what doesn't work. And so that's, some parenting skills that we wanted to discuss with the moms and things to try out back at home and report back to the other moms. And we saw this over and over again where the moms were like, have you tried this? And, oh, I haven't tried that. That's a great idea. And so they were supportive of each other with different ideas of, how they can manage their children and discipline in a way that everybody gets something out of it. Session 7, safety plans, community responses and resources. So here, we wanted to provide the women with, all the resources that they needed for this particular area. Sort of a systems navigation, how to get through the family court system, how to get, who to contact for this, and so that was a very helpful session for the women. Session 8, stress management for moms and kids. I mean, I think most of us kind of don't like the whole self-care, what we think of self-care. And so we wanted to come up with some real ideas of stress reducers. And we did not tell anybody to take a hot bath, but there's lots of things out there that can help the women in reducing their stress. Session 9 was mom time and having fun with their kids. And some of the women financially are not able to do all these activities that, you see all over Instagram or what have you, but there are lots of things that you can do with your children that didn't cost a lot of money and, some real quality time. So we went over some of those. Session 10, the closure and saying goodbye. They attend their children's little graduation ceremony and the facilitators were great at, speaking about every child and, really talking about their strengths and things like that. And we had, everybody's kind of in tears at the end of that. They're like 7 and 8 years old. They're so cute. But the moms are like, that's the first time ever anybody's ever said something nice about my child because they're, getting in trouble at school or, what have you. And so we made sure we had lots of nice things to say. And it wasn't a stretch. We weren't making anything up. These kids are they was really lovely working with them. So it wasn't difficult to come up with some nice things to say about them, and the moms really appreciated it. And that was one of the best parts. Not that I enjoy seeing people cry, but there were tears of joy. So that's always great. So that's the program sort of in a nutshell. Um, some of these testimonials are nice. Um, I will let you guys read those when you see the PowerPoint, but I'm going to bring this one up. And so, you've got kids who attended and they're asking like, when can we go again? And we did have repeat attendees or participants. Um, we had some moms come in more than once, but with different children. We had one mom come with the same child twice because they, thought the program was great, but they wanted to sort of reinforce their learning. And so, yeah, and we didn't have any hard or fast rules about it. If they wanted to come again, that's fine with different children or what have you, or children that, we've had some moms say, oh, my child is 5 or 6. Like, I'd love for them to take, part of the program if we ever, bring this program back into the Courage Center, which I think we will. I'm going to sort of skip over some things here, but the long-term goal for us was sustainability, was to, I'm sure you guys are used to, you get these very lovely grants, federal grants, and we love the opportunity to participate in those grants, to do a pilot. And then you're like, sort of, what do we do in the end when that lovely Cadillac money, runs out? But we've had for the last 6 months some very good conversations with the provincial government. They did attend our knowledge symposium. Um, and we are going to do a provincial rollout. So we're really pleased with this particular pilot because we are going to be offering it for it to be housed in other shelters throughout the province. It's not going to be the same budget, but we have people who have outreach workers who could do the moms group. We have child witness interveners who could be doing the children's program if they had another staff member or volunteer, because it's usually one facilitator with the moms and two facilitators with the children. And so we're pretty excited. Part of the money from this PHAC program was indeed to sort of help the sustainability and in materials and things. So we were able to sort of originally it was we could assist maybe two other agencies with supplies and manuals and things like that, but we've been able to sort of stretch that out to six. And so we'd be very happy to be able to continue the program here at the Courage Center and then offer it to six other agencies across the province, and then hopefully, other agencies across the province sort of take part too. And so on that end, really successful in the program going from there.
The first
Ginette,
question, Jeanette,
une personne, elle est intéressée à savoir et à
someone would
apprendre
like to
si
know
le
and learn
manuel que
whether
tu
the
faisais référence
manual
pendant ta
that you
présentation,
talked
est-ce qu'il
about,
était révisé à chaque fois
was it
que vous
revised
aviez des feedbacks
each
des
time you
facilitateurs
got
ou il a
feedback
été
from
créé
the
spécifiquement dans ce
facilitators,
projet?
or was it always the same manual throughout the program?
It was indeed the same manual. Like I said, the program was designed by Dr. Sandra Graham Berman from the University of Michigan. And because of the pilot, we wanted to stay true to the exact way that she designed the program. She's been running this program in the States for years. Has it been updated? Yes. Has it been updated recently? Not sure. And that was one of the questions we had regarding the sustainability of the program. Would we engage her? It's a copywritten program, so would we engage her to make tweaks to her program? We didn't really, we didn't really want to do that. There's nothing wrong with the program, don't get me wrong. But we thought our best way of doing that would be sort of accompanying guides. So sort of more relevant activities, more relevant things that we could add to the existing program. But it was the same guide. And I don't know. Um, I'm looking at some of her research. I think she's done research. It's quoted in the manual from I want to say 30 years ago, 20 years ago, 10 years ago, 5 years ago. And so I think there's room for some updating. But again, we're going to be doing some accompanying guides for these other agencies in the province who might want to deliver the program, but it gives you a little bit more flexibility.
Merci.
Oh,
Merci, Ginette. Une autre question qui va
Jeanette,
être
another
autour
question
de
concerning
autour des fratries. Euh,
siblings.
euh, est-ce que vous avez eu des
Did
fratries dans vos groupes
you
d'enfants?
have any
Qu'est-ce
group?
que vous avez observé dans ce groupe de
What did you
fratries?
observe when there were groups of siblings?
right. We did. So we've had other programs come through the Courage Center, some provincial programs and some just sort of programs that we had here. And there was always provincially there was a program that said no siblings. And here again, we went with the way the pilot was written, and it didn't have anything saying anything about siblings not being able to participate together. And so we went with that. We did have some groups in Fredericton where we had multiple siblings, and it just sort of created the best way to describe it. It was like as if they were playing in their living room. You know what I mean? Like they were just they were the only ones in the room, like four siblings out of a group of six children. They're going to take over that group. we had a particular mom who participated in the program, started out with her two daughters, and those two little girls did not get along. And so it created something in the group. It created the opposite of what we wanted in that group. It's some cohesion and some cooperation and, so I think that's, it's just the way take that back. That happens a lot in siblings. They're 6 and 8 or 6 and 9. And do we want to place a restriction saying no? I'm not sure, but we have seen it being more problematic than it being helpful to have siblings in the same group. And that's just an observation in the groups that we've had.